I just want to thank everyone for tuning in. We hope that this is kind of informational. We'll start with some kind of intros of the key players. I am Justine Stremick. I'm the president-elect of GSACEP. I am currently active duty Army stationed at JBLM. And yeah, I'll let Jillian and Laura and Christine and Sean maybe say hi.
Sure. I'm Jillian Schmitz. I am an emergency physician at Naval Medical Center San Diego. I'm actually a civilian, but I work for the DoD and through USU, and a past president of ACEP and longtime member of the Government Services chapter. Laura, I'll turn it over to you.
Okay, Laura Worcester, Associate Executive Director for Advocacy and Practice Affairs for ACEP. So I oversee our government relations and our reimbursement work, all of our advocacy at the federal and state level. I do have a husband who works for the Department of Veteran Affairs, so I know a little bit of the federal employment side, but he's civilian, so that's about it.
And I'm Christine DeForest. I am the president-elect. Next will be in April, so like heading into that part, and I'll be teaming with Justine. So I have been our chair of the advocacy committee for our chapter, and am on the call just sharing that experience, and so grateful for the opportunity to be able to have our open dialogue and discussion today. Sean?
Evening, everyone. This is Sean Stewart. I'm currently the president of GSACEP, and I am active duty Navy EM physician out of Virginia.
All right.
I want to say thanks to everyone for showing up. Again, we've had lots of questions, and thanks to Justine and Christine for helping to coordinate this, as well as our two guests who are going to provide us hopefully a little extra wisdom on what we can't do as federal service EM physicians. So, Justine?
All right, so I'm just going to kick things off with a little background information on kind of our advocacy journey within the chapter. So like I said, I'm active duty in the Army. I got involved in the chapter around 2018. In 2021 is when we formed, at the time it was the Public Relations and Advocacy Committee. I served as the sub-chair and then the chair of that committee. And one of the first tasks that we were kind of to do was to develop an educational product for the chapter leadership and membership on what we can't and can't do in advocacy. So a combination of kind of research and meetings with the ACEP legislative affairs team, we came up with this advocacy white paper that kind of highlights broad guidelines regarding kind of the right and left limits of your ability to participate in the political process as a military emergency physician. I think Michelle's going to link that in the chat. The purpose of this webinar is just kind of reinforce some of those guidelines in the setting of kind of the current political landscape, and also touch on how maybe a little bit more into kind of how non-military federal workers can get involved. As military members, there are restrictions on how you can interact with your legislators during advocacy efforts. I'm going to post another link here that goes kind of broad, but I thought it was helpful and kind of link some of the DoD directives and goes into kind of some specifics. So basically, the limitations are intended to prevent any appearance of bias or partisan support by the military. However, you can participate as a private citizen within certain bounds, to include reaching out to your representatives, attending events as spectators out of uniform, and making personal donations to campaigns. Any participation in lobbying or other efforts must be conducted as an individual and on your own time. You should not be in uniform or identify as a member of the military. If you're taking part in any activities that occur during normal work hours, you should be on leave for that day. Let's see. And then I just want to end by saying, like, if you are planning on participating in any advocacy activities, best to contact your local judge advocate for kind of specific guidance to avoid any trouble. So with that, I'm going to turn it over to Christine. She's going to discuss a little bit about her kind of experience in advocacy, in specific, I think, with the Leadership and Advocacy Conference that ACEP puts on.
Thank you, Justine, and thank you for that background. Certainly, we have had more questions and from our members on looking at how they're able to participate in advocacy efforts and doing that responsibly. And there's been a little bit more energy behind that most recently. And so review of those guidelines and the tips on how to manage that is really helpful and has been a long time question, but most recently, certainly an uptick. For me, before becoming the chair of our advocacy committee, I attended LAC, which is a leadership in advocacy conference put on by ASAP. And that was a really eye-opening experience for me. At the time, I was stationed in California as active duty, and it was a time just as we were closing down on COVID, which was great in that there was a lot of energy to be back in person, but it did affect the volume of our own chapter's members' ability to participate at that time. And so in turn, that created an opportunity for me to really network across into those that were working in civilian facilities and part of a state chapter of where I was living at the time. And that was a good experience because the particular state of where I was really had a lot of energy and a lot of representation for the conference as well as within their chapter. And that was one thing that I took away from was the volume of people that are just truly invested in representing the experience that us as emergency medicine physicians have in our workplace, and also advocating in a way that will improve our ability to work and efficiently, and with a self-satisfying role in that, but also the care and that we deliver to our patients and the pride that we have in advocating for change that will make that much better experience, but also improve the care that we can give to our patients. One of the takeaways that I also had was just a introduction into the volume of work that ASAP does for us as members for all chapters. And with that is a lot of effort behind initiatives that help in looking at the long uphill battle for some changes. At the time and still now, we look at workplace violence, right? That was one thing that I had lived and experienced as a physician, but I hadn't understood where ASAP fit into that or where advocacy on the Hill looked at how that fit into future policy changes that would hold hospitals accountable for the environments that we need to have to be able to perform our work safely for our own benefit as well as all the patients in a department. And that's a tangible experience for most of us that hits home, right, in a very neutral, what seems to be a neutral topic. But I walked away from LAC with a primer on understanding the ins and outs and the background on what it takes to have policy change and sustainable change with that as well. The final thing that I really encourage anytime somebody asks if there's ways for them to become more engaged in our own chapter or for them to become more aware, and I hope that Laura will share even more advice with us as well. But we do have a fellowship that helps in supporting the growth for young physicians and residents within our own government service chapter. And I see Mike Ramirez on the call, and I'm so excited to see him because he has been one who has benefited from a fellowship and has had then that hands-on experience within our own chapters advocacy efforts, but also in attending council and bigger ASAP organizational meetings that help in looking at how we guide the efforts that our entire emergency medicine community should get behind. So with that, I want for us to be able to transition a little bit into some of the more nitty-gritty and specifics. And we're going to transition to Jillian and Laura an opportunity. But I first wanted to pause if there's anything that you want to kind of frame before we delve into questions.
One thing I can share is just in terms of how to get more involved in the ASAP side of advocacy. So real easy. I'll put it in the chat later, but asap.org/911. And that's where you can sign up for our 911 grassroots network. As part of that, you get weekly updates about what's happening both in DC and the States. And sometimes we'll put out an alert through that network where you can take action by emailing your legislators to ask them to either support or oppose something that's come up in Congress that ASAP is paying attention to and taking some advocacy actions on. It's super easy when you use the system to send an email. It'll actually use your zip code to look up who your legislator is. And then it'll even pre-write an email for you to send, although we definitely encourage you to personalize that and modify it to kind of fit your voice and tell your specific story. The webpage that I talked about also has links directly to our Advocacy Action Center, where even if you're not part of the 911 network, you can help take action on key issues that ASAP is tracking both at the federal level and in the states. And then you can also, if you've gotten into a lot of that and you want to really take your advocacy to the next level, you can, there's a link there to learn about ASAP's Advocacy Leaders Program, which is where we'll do additional trainings for advocates to be even more active and really kind of what we call grass tops. Grassroots is where we have as many of our members as possible, let's say, send one of those emails I talked about. Grass tops is where we encourage folks to start to develop closer relationships with their members of Congress, get to know them, go to some of their events, things like that. And we have a number of ASAP folks and leaders who will have cell phone numbers of their member of Congress or their senator. So then when something really key comes up, we may ask them to really lean on that relationship and flag what the hot issue is that we're most concerned about. So again, asap.org/911, and that can really help you figure out ways to get involved. It has links to LAC that was talked about already. LAC is coming up. You can still register if you haven't yet, and come to DC. We'll be talking about some key issues this year, including the boarding crisis, Medicare and Medicaid cuts, things like that. So definitely a lot going on right now in DC in more ways than one. So we're hoping to have good numbers to really have emergency medicine be represented there. So I am happy to talk about literally anything. I didn't want to prepare something because then it'll be kind of old news to some people or not really what's of concern to others. And I know there's so much going on, so I'd much rather just take questions along with Jillian. So.
And I'll just take a second to kind of step back for a second, because I recognize the names of some of my several former medical students. So some of you may not really even understand what is advocacy. And so just to kind of explain that we recognize that emergency medicine is at high risk of burnout, and a lot of things is felt to be beyond our control, or these massive problems that we can't fix. And for me, a big part of the value of ASAP and GSACEP membership is trying to advocate, right, for those things that get you crazy. So whether it is a lack of mental health resources for physicians during COVID, whether it's Medicare funding and being able to, expand access to patients, there's so many ways that being involved, that really what advocacy is at its core is allowing your voice to matter. It's with meeting people and making those relationships with people who have the ability to fix things. And I'll share with you a couple examples of that. But when I was in San Antonio for 11 years, I got to know my congressman. He actually is like one of my neighbors. I have his cell phone. He texts me regularly with questions on healthcare stuff. And he was a Republican. And right after the shooting in Uvalde, which was in our backyard, a lot of conversation came up about gun violence and how can we get involved in a very political topic, particularly for someone who is a Republican in a district that is half red, half blue, of sharing those stories and what happened in the ER in Uvalde that night. I think really helped shape the legislation that came out of that to have more protections in place to protect our patients. And a big part of that was that relationship building for him to be able to advocate for tighter laws in Texas that would help our patients. Another great example that came out of this chapter was one of our former doctors, Laura Tilley, who's been a leader in this chapter, was getting frustrated that when she would encounter patients who had suspected opioid use disorder and who were getting prescriptions from millions of different places. On the civilian side, right, there's sort of most states have a database where you can search by the patient, you can see how often they have filled their medications, how many narcotics they're taking. But on the military side, that didn't exist. And it was very difficult to track how many people were getting different prescriptions, and that there was no communication between the DoD and the civilian side. And rising and recognizing the issues with opioid epidemics, she really tried to push that. And from the top of the hospital was basically told, oh, we don't have an opioid problem in the military. It doesn't exist. We all know that's not true. We have the same addiction issues that the civilian side does. And Laura was able to work with our chapter and with our DC office through Laura Worcester and through Brad Gruen and a number of other people to help introduce legislation that was eventually passed that now is enforced and allows us to be able to incorporate and communicate all opioid prescriptions through the military with the civilian sector so that we can pull reports. You can see when people fill their medications and identify those people who are at high risk that may help you with your prescriptions, right? And is this a person who is at high risk that I don't want to give narcotics to, or is this person lying to me about, when they took their last medication? And no one would have had the ability to do that as individuals, but as a chapter, as an organization, we were able to work together to help make that happen. And I think that is sort of the power of advocacy. Justine, did you have a comment?
Yeah, I just wanted to mention that like her doing that, just like the importance of that, because her doing that is actually what set off kind of the chapter looking to get more involved in advocacy, and the PR and advocacy committee was formed like shortly after she took those actions. So just to highlight like the impact that Laura kind of going after that and doing that has had on kind of the direction of this chapter, and it's just the impact that like one person can have.
Absolutely. And I think there's a lot of misunderstanding, and people think, oh, I can't advocate, I can't get involved, I can't lobby because I'm in the military, I work for the DoD. And that's not true. We would very much love to have you involved. You can't go in uniform, right? There are rules. You do have to take leave, as Dr. DeForest was saying. But many of you may never have been to Capitol Hill before. And I think for especially the young physicians, it's such an eye-opening experience because most of the offices of your senators, your congressmen, are really, when you meet with people, you're rarely meeting with the member. You're often meeting with their staffers, who are typically people in their 20s. They are super smart, very, very motivated. But many of them are young, healthy people who have never been to an ER. So they don't understand when you come in with an issue about boarding or something specific that you saw in the emergency department. They may not have that lived experience to really put that into context. And a lot of what we do when we say advocacy is we're sharing stories, right? We're sharing patient encounters, like this happened to me on my last shift. And as Christine was talking about ED violence, like how many emergency physicians have been assaulted, how many of our nurses have been verbally or physically threatened, and how can we create really legislation that will help make that a felony? How do we protect ourselves? That is the power of kind of those voices. And you can absolutely do that. And we would love to have you involved. And even in my role as ACEP president, I was able to do that as a federal employee, but I had to be careful and I had to take the right steps, both with my hospital and with ACEP, to make sure that I was voicing my opinions, as an individual, as an ACEP leader, and not as a representative of the Navy or of the military, and that these are my views and my views only, and they don't represent the military, just as you would in any kind of PowerPoint slide or a presentation that you're giving, of having that disclaimer at the front. But those voices can be really powerful, and your stories can be really powerful, and helping people who may not have ever been to an emergency department understand the significance of what we're advocating for. And so the more we can do to get you guys involved and empowered to make a difference, I think that the better. But I'll stop there and see if there are questions or comments, and we can also at some point here stop recording if people have comments or questions they would like to share but do not want to be recorded.
When it comes to social media, would you say the same kind of guidelines and restrictions for in-person advocacy kind of translate to social media advocacy?
Laura, you want to take that one, or I can? Yeah. Yeah, you're
I
like, no,
can't speak, so I can't speak to the
Yeah.
military restrictions or even federal employee. I would just caution being really, really careful, honestly, because on social media, it's a permanent record of it, whereas a verbal conversation with a staffer is a little harder to yeah.
I would echo that. I think in general, even, not in the military, as a civilian, you got to be very careful what you put on social media. And there have been numerous cases of people losing their jobs because of a comment or something they said, even though they thought it was a private group of people, taking pictures and sharing it. That I would be very careful on social media. Just because it's hard to separate yourself and to have those disclaimers. I think it is safer to do things through the 911 network that Laura was talking about if there's a specific piece of legislation. And again, that's a great way if you want to get involved or advocate for something, but you don't have a ton of time or bandwidth to do stuff. It literally is a button from your phone that you can tailor a pre-written email saying, I want to advocate to do this or to pass this bill or to pass this piece of legislation. But I would probably not share it on social media just because you have less control over how that could be used in the future, and it is a permanent kind of recording. A good question.
Thank you.
I think, Michelle, if you want to maybe stop recording, I have some other kind of thoughts and comments, but